welcome to the Headache Doctor Podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication, allowing you to thrive in everything you do. Hello and welcome to the Headache Doctor Podcast. I'm Dr. Taves, your host. As always on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. On today's podcast, I have Lauren Kight. She's a dentist and a myofunctional therapist, and I'm excited because she's doing great work for those of you who have headaches and migraines and in a specific problem that we're seeing with so many people. This is the second time we've had a provider that's providing these myofunctional therapies, and but this is from a different approach. I'm really excited for this conversation. Thanks for being on the show.
Thank you so much for having me.
Yeah, absolutely. We talked last week, and you shared your personal story. Personal stories are helpful context for the listeners, but it's also just it provides that sort of idea of this provider cares, right? So the sterile Western medicine, lab coat, you're in and you're out, you get less than 5 minutes, like that sort of feel, anything we can do to push away from that and provide a more personal product, that comes when providers have their personal stories. So I want to start there and you just share with the audience your personal story.
Yeah, so I'll start at the beginning, which is how I got into healthcare. Growing up, I just had this obsession with anything doctor related, and also had an obsession with pulling out friends and siblings' teeth. So I got to college and was like, I want to help people, and so I was gonna do healthcare, and dentistry kind of seemed like a good thing for me to be able to be both a mom and wife and have a career that didn't require me to be on call a lot and all that. So I was like, let's do dentistry. So I did. I went to dental school in South Carolina and got done and quickly realized when starting to see patients that people do not like the dentist. I was told pretty much all day, every day, like, hey, no offense, but I really hate the dentist. I'm so anxious here. And so I kind of, I think more than anything was like, how do I make people feel calm and all that? But a couple of years in, my daughter started having, I realized she's having all these sleep issues. She's like gasping for air at night. She's snoring. Her tonsils are literally touching each other. And I take her to the pediatrician or other doctors, and I'm like, hey, there's something wrong with her. Like, she's 3 and this shouldn't be happening. And I'm getting the response of like, no, this is normal. They'll grow out of it. And I'm like, no, that doesn't sound right. But okay. And so I end up going to the CE course, continuing education, and find out, in fact, that this is not normal. And so I kind of got into this path of airway dentistry and figuring out, it all started with how do I help my daughter, and then turned into this whole thing. So a couple years after I figured that out, I started working, actually I just fell into my lap beautifully, worked in this airway-centered dental practice, and with some phenomenal women who just, they wanted to help children, and then they wanted to help people that were having that chronic jaw pain and everything. So I was there and then realized very quickly, like, oh, I've had jaw pain and headaches for years and years. I was taking 800 milligrams of ibuprofen every day. Wow. Terrible for your gut.
Yeah.
So I destroyed so much of my body from that, but I was just in so much pain and just trying to get through it. So I actually started going through treatment at that practice. And for the TMJ issues, COVID happened, everything shut down. We actually moved. This was our third move since I had graduated from dental school within, like 3 or 4 years. And so it was our third state to move to. We were moving to Florida. I was unable to get my dental license in any sort of easy manner moving there, and with COVID shutting everything down. So I told my husband, I'm done with dentistry. Like, this isn't working, this is stressful, I'm in so much pain, and we keep moving, I'm done. And so we get to Florida, and I am still, like, my body just broke. Like, I was having migraines every day. The jaw stuff was worked out. Like, I had gotten a bigger airway, a wider palate, all that stuff with the treatment. But, I mean, my arm, my whole left side of my body was numb. Like, there was tingling in my hands. I couldn't be a mom or wife that I wanted to be. So I started kind of on this functional medicine pathway of, like, finding providers who were going to, like, find out the why behind my symptoms. And so I did that. And then about a year into it, I figured out, like, oh my goodness, like, I have a tongue tie. My tongue literally cannot reach the roof of my mouth. I am a dentist, and no one has told me this. I have never learned this. It was a posterior tongue tie, so they're very difficult to diagnose. And so I ended up going through myofunctional therapy, ended up getting that tongue tie released. It changed my life, and the migraines went away, all the stuff. So here I am now. We actually have just moved back to Colorado, and when we were in Florida, I had started homeschooling our children. I was able to be home with them, and so in moving here, I was like, gosh, I'm really loving this life of getting to be with my children. But at the same time, I have all this knowledge, and I've been on this whole journey, and I want to be able to help people, because whether it be at the park or talking to friends or whatever, there's like so many people dealing with these same things as me, and it's taken me years to figure out how to get to this place of feeling like I'm not in pain anymore. And so I want to help other people. And so I've decided within the past year, I'm just solely practicing myofunctional therapy, and it's something that I can do with my dentistry background, but also see patients and also have that life that I want to, being able to be at home with my kids. So
yeah, that's amazing. I think there's a few things that people probably heard that piqued their interest. One is you talked about how you're having daily migraine symptoms and this left-sided like numbness, tingling. I'm sure there's a lot of people out there that can resonate with that, and they have similar symptoms. And then I also think but let's start with the term myofunctional, and let's understand what that means, because obviously it has something to do with airway and how we breathe. There's something with the tongue in there. Tie all that together for us.
Yeah, so, and I'll be honest, when I first heard about it as a dentist in that practice that I was working at, that was very airway-centered, we worked with a myofunctional therapist, and I mean, I really didn't understand even what she did. So I think it is great to break that down for people. And I think just like the simplest way to put it is when you have a myofunctional disorder, there's lots of different words for it, so that makes it confusing too. So basically, it's that there are muscles in your face and in your neck and in your mouth that are not working properly. And so what the therapies aim to do is to identify those dysfunctions, and then you want to, educate the patient that, like, these are your dysfunctions, and then you're doing exercises to help retrain your brain to work properly. So I guess kind of the easiest way I think to explain it is there's 4 goals that you want to accomplish in there. So, if you're having an issue with any of these 4 things, then you probably need myofunctional therapy. And it may not be as simple as that. Like, there's obviously lots of things that could play into it, but you want to be breathing through your nose all the time. You want your lips to be able to be closed all the time. You want your tongue to be able to be sitting in the roof of your mouth, which that's the thing for me that I was like, oh my goodness, like, I can't put my tongue in the roof of my mouth, which then led to me not being able to close my lips and all that. And I would have told you I'm not a mouth breather, but then I was, oh yeah, I am. So, and then you want to be able to swallow properly, and that's kind of like the last piece, because if you can't put your tongue up and breathe through your nose and all that stuff, then you can't swallow properly. So I think that's the easiest way to explain it.
That's perfect. That's perfect. Yeah, what an overlooked area. I mean, how many times, well, yeah, I don't know if anyone's really thought about how we breathe, how we swallow. When I started going through the process, I'm like, oh my gosh, like I was asked, like, where, just close your mouth and where's your tongue? I was like, well, it's kind of like pushing against my front teeth.
Yeah.
And it's like, well, it should be resting on the roof of your mouth. And what was fascinating were all the implications of that.
Yes.
And I want to talk about that a little bit, because if your tongue isn't in the right place,
Yes.
Like what happens?
It changes everything. So I guess, so if your tongue's in the right place as a baby and as a developing child, and if you're breathing the way you should, and then theoretically your jaw should develop properly. It's harder in our society today because we eat a lot of processed food and all of that. But like for instance, I've spent time in Kenya, and you go over there and the people there, they hardly brush their teeth. Like they brush it with a stick where we were in the middle of nowhere, but they have the most big, beautiful jaws with these big white teeth. And it's because their tongues are where they're supposed to be. They're breastfed for years, and then their jaws are able to develop properly. So first of all, like if your tongue's up there, then it helps your jaw get where it needs to be. If it's not, then you can do things like braces and these palatal expanders and everything, but then you get out of the braces and everything goes back because you're swallowing so many times a day improperly, and so then everything's just sinking in and wants to go back where it was. So there's that. If your tongue's not in the roof of your mouth, then you can't suction properly. So when you're sleeping at nighttime, your mouth's going to hang open, which then the tongue falls back into the airway. Even for a child, like I think it's a 6-year-old, if their mouth is just open a little bit, it's like they're breathing through a coffee stirrer, which is like, can you imagine, like get a coffee stirrer and try and like breathe through that? Like that's so hard. So then it just has this cascading effect on everything. Then the muscles inside of the throat and inside of your mouth start to lose tone, and so that's when you start getting the snoring and sleep apnea. So I mean, your tongue not being in the right place, like it's a big deal.
Yeah, that's it's amazing.
Yeah.
Never thought about it. So you this is unimportant, but you said that they brush their teeth with a stick.
Yes.
Like what does that even mean?
I guess like it's literally like a stick. So where I went, I mean, it's like the middle of nowhere in Kenya. It's in the bush, and like they literally would just like find a stick, and I mean, I guess it's manually removing debris, but
sure.
Yeah, they would just brush their teeth with a stick. There's no toothpaste.
Tree bark is
but they have the most beautiful jaws, most beautiful teeth, and you're just like, what's wrong with us in America? Like,
yeah. What's fascinating is, so you mentioned nothing. What's assumed there is that they don't have a mouth full of cavities and painful teeth, and like their dental health is good.
It's relatively good. I mean, when I was there, I was actually in dental school, and I would have people come out and be like, my tooth hurt. I mean, yes, they get cavities,
sure.
But it's crazy. Like these people literally have no electricity, no running water, none of that, but yet like they don't have airway issues. You know, it's crazy.
Yeah, I'm curious, and I think I know the answer. That's why I'm asking it. But there's implication as far as like the tooth itself as well.
Yeah.
Right?
Yeah.
I mean, and how like occlusal, how the teeth contact each other, and that force.
Yes.
Because if the jaw's not lining up, the teeth aren't lining up.
Right. Yeah. And I mean, really, if your teeth to some degree are gonna like stay in line, just because if they're biting, right? You know what I'm saying? But then that's just. It's kind of like, so for instance, for me, like my upper jaw was too far back into my airway because my tongue was never where it was supposed to be. So then my lower jaw was held in, like by my upper jaw. So then my lower jaw was shoved back into my airway, which then caused my disc in that jaw joint to come forward. So then every time I open and close my mouth, there's popping, clicking. My jaw like is so tired after like chewing for a meal. So to some degree, they like stay together, if that makes sense, because your teeth are holding them together. But it can definitely affect the jaw growth.
Yeah, so the teeth will find a way to contact each other. Your jaw will just pay the price.
Yes, absolutely.
Yeah, and then that leads to compensations in like the jaw musculature, the positioning of your neck.
Yes,
and then
all of it.
Yeah, and then if you're trying to breathe at night, or really at all,
ever.
Ever. to expand your airway will impact those things as well. Like you're just having to work harder to do just basic
everything
things.
And then that affects like all the organ systems, like your brain's not getting enough oxygen, which is why you have these children that are hyperactive. You know, it's like they want to, and they're not getting sleep at night, they're not getting good quality sleep, so they they're wired. That's how my daughter was. Like I wouldn't have told you like she has ADHD, but like if she sat still for more than 2 seconds, she'd fall asleep. And so that's why I was like, something's not right.
Sounds great.
Yeah, it's really great. So yeah, it affects everything.
Yeah. I guess I was making a joke on like getting your daughter to fall. It takes about an hour to get my daughter to fall asleep. So.
Yeah, no, she sleeps great now.
3
even
books,
yeah,
it's like anyways.
Yeah, but then they're like all the time, and you're just
totally.
like, please sit still.
Yeah. So one of the things that we were talking about is you work with kids.
Yes.
Which has huge benefits because preventative care. We don't want you to get to be in your 30s or 40s or whenever and have to work backwards and realize that you've had these issues for so long. So, but the other thing that's kind of interesting, and I'd love to hear you speak to, is like, kids are, like they can't sit still, like to follow instructions. Like, I'm sure there are providers that just sort of stay away from that for different reasons, but I want you to speak to, one, the importance of catching this and treating kids, and then just kind of how you do that.
Okay, so I think part of my passion for children is just, one, like my daughter's issue, which I have 3 daughters, and now all 3 of them have had the same issue. I just knew how to fix it after the first one. But I think that her having those issues just kind of, I want to be able to help children. And then working in that practice I worked at in Omaha, just seeing, it was kind of like we had 2 ends of the spectrum. We had the patients who didn't have it fixed as a child, and so they are in chronic pain. There were many of them that drove from way out of state just because they had been to doctor after doctor after doctor who could not fix anything. And so we were like their last chance. They were just done. Like nothing was working. But then on the other end, we had kids that we were working with. And so knowing that you were like avoiding this other issue down the road, just for me, that's so exciting. So I also just enjoy there's so many parents that don't know about it. And so, like I said, I went to my pediatrician and literally was basically blown off of just like, this is fine. So I talk to moms every day. Like my kids are in so many different things and just interacting with people every day of like this, my child's having XYZ problem. And I'm like, well, have you ever looked at their airway or any of that? And they're like, no, how do you do that? And so just like very brief conversations to educate these parents makes a world of difference. It may not be that I'm actually treating anything in them, but just educating them and kind of getting them on the right path, I guess, is very helpful. And so I love even just doing that. But so with kids, it is a little more tricky. A lot of times it's going to really be based on, is the kid compliant to some degree? And then also, is the parent willing to work? Because it depends on the age of the child too. I mean, we can do stuff with real little, a toddler. My 3-year-old can do exercises. We have to make them fun and exciting, and she's not going to go through an entire myofunctional therapy program at 3 years old. But there's stuff I can do with her now to help her learn to breathe through her nose and close her lips. That's going to make a world of difference even in the 2 to 3 years it takes for me to do a full program. So, but the parent piece is a big part. If I have a parent who wants their child to have myofunctional therapy, but isn't willing to, a lot of it is practicing at home. So if you can't practice at home, then it's really hard to do it. So that's a big piece of it too. But really, just making it fun for the kids. I mean, it's silly exercises. Like the older kids, a lot of times they're embarrassed. They're like, well, that looks so dumb. But if I do it with them, then they're laughing at me, and then we can laugh together. So, but yeah, I mean, really, a lot of it's parent education, just making them aware of like, this isn't normal. There are things to do, like don't freak out, but there are things we can do now And then each step along the way, as the child grows and matures, like, let's do the next thing.
Yeah. Yeah, I tell people here that, we're selling crock pots, not microwaves.
Yes.
And it's just, it takes time. Like, and I personally, and I'll let you speak to this when it comes to your process in myofunctional therapy, but when we get someone that's motivated and they're willing to put the work in to make these changes, outcomes are better.
Yes.
But also, like, as a provider, it's more enjoyable.
It makes it so much easier.
People that really care about their health. And so it sounds like the people that you're going to attract and that are going to go through the process, like, kind of have to really care about their health.
Yes.
Or at least mom or dad does.
Yeah, and I think, honestly, the people I've encountered with myofunctional therapy, usually they're the type of people that really do care. Because they're willing to go outside the box of just like, okay, I took them to the pediatrician and they said their tonsils are touching, but that's normal. Like, they're willing to go, no, that's not normal. I'm going to find someone who can help me. So I do feel like most people that come my way, like, they're ready to take that step. So.
Yeah. Okay, so speak to the mom that, like, has a newborn. Because I know there are things that can be done to prevent it from getting to the point of, like, your child needing myofunctional therapy.
Right.
But you're saying, like, because you got 3 girls? Is that right?
Yeah.
Yeah. So the first one you found out kind of later in the game.
Yeah, she was 3.
3?
The other 2,
she was 3. Okay.
Yeah, I mean, I figured it out pretty
not too
quickly.
late.
No, thankfully. But I still was like, I'm a dentist. Why don't I know this? But the other 2, my 3rd was born. They handed her to me, and I was like, she has a tongue tie. The doctor was like, what? And I was like, don't worry about it. She has a tongue tie. We'll get it taken care of.
That's hilarious.
So, yeah, at that point, I was well versed.
Like your first response.
Yeah, that was. I was like, no, she has a tongue tie. So, yeah.
That's hilarious.
Mom. Clearly, this is my brain.
I heard back in the day they had the midwives just keep their pinky nail long and they just swipe.
I've heard that too. I don't know. That's full. Yeah. I haven't gone through a tongue tie surgery myself. I'm like, ooh, that kind of makes me cringe. But, they're babies, so maybe they don't remember. I don't know.
Yeah. So that's one thing.
Yeah,
assess for tongue tie.
Yeah, with babies, I'd say if they're having any issues with nursing, see a lactation consultant. I mean, just do it. Like, it's worth every minute of your time. I had a lot of issues with that. Now I know it's because my children all had these issues. And, I saw a lactation consultant and just honestly find a good one. I guess that's the best way to say it. Find one that's really willing to think outside the box and all that, because mine was just kind of like, you're not doing great, and I tried all these different things.
You're not doing.
Yeah, it was just kind of, I'm like, I'm trying, I'm doing everything. So I think find a good one, which I've met a couple here in the Springs that have been amazing. So and then there's like Dr. Jessica, seeing someone like her who can evaluate that tongue tie, because if you fix things in the beginning, it will literally change your child's life.
Yeah. Nursing, addressing a tongue tie, it's probably not something that, like, an OB would necessarily look for.
No, and even pediatrician. I told my pediatrician, like, hey, the 3rd one, I was like, she's got a tongue tie, and she's just kind of like, okay, like, she just didn't care. And I was like, okay, well, I'll be taking her to somebody else now, and a girl in my practice that I was working in did do those surgeries, so she was able to do that surgery she was like 2 weeks old, so we got it done pretty quickly, and I think it's helped. Now, she ended up in the NICU right after for a week, not from that surgery. She had RSV, so she did have some reattachment, so we've got a road ahead of us, but she's 3, and we're just going to wait until I'm working on the exercises with her now. So sometimes it doesn't go always as planned. Like, sometimes you get it done, and things still aren't right. That's like you said, it's like the crock pot thing. You got to just keep slowly just attacking whatever it is that's right in front of you.
Yeah, so the tongue needs to have the mobility it needs. And then we need to use the tongue, which I'm going to say is the proper foods. I mean, you mentioned like processed foods.
Yes.
And I'm assuming there that it's just when you don't need to like actually chew and break things down.
That causes
That's
an
a problem.
issue. Yeah.
Yeah.
So yeah, I mean, with my daughters, what I did as much as I could, I weaned the baby-led weaning. You know, trying to cut up as little as possible, giving them like real food, real vegetables, real fruit. If it makes you, my mom would still, like up until a year ago, was like cutting my 3-year-old's grapes. And I'm like, Mom, she's been biting them since she was 6 months old. She's going to be okay. So, but I think it's that mindset too. A lot of people are just like, your kid's going to choke. And I mean, and you have to watch them closely. There were instances where they would, you know, you're watching and I've had to hit them on the back a couple of times, but they've all been fine, you know, like them learning to chew and chew on real food is so important.
Yeah. So my son is a fantastic chewer. I mean, I'm more worried about myself choking than I am him. He's 1.5 years, and yeah, I get stressed out from like, you know, 0 to, well, maybe not 0, for like, when are they starting solids? Like 6, I don't know.
4 to 6 months.
4 to 6 months.
Say
Yeah,
now,
yeah. Whenever that time starts to like 18 months. Every meal I'm like I don't like this, but
you just gotta get really good at the Heimlich in case you need it.
Yeah, totally. Yeah, that doesn't sound comforting. But my wife is a lactation counselor, and like, so this is kind of our world.
Yeah.
And even though I know it, and I'm like, yes, like it just, like I totally get it. How, like, just the baby food and processed pureed, like I get why that. Just get the calories. Like, don't worry about chewing. And the whole chewing aspect of things is just overlooked.
It is. It's so important.
Yeah, and then the tongue, moving food around, and just knowing how to use your tongue. Yeah, even my 1.5-year-old last night, he was looking at me and his mouth was open. I was like, Teddy, close your mouth. And he did it.
Yeah,
he did it.
They will. They'll listen. They will listen.
Yeah, he just said "dada" for the first time like a couple weeks ago.
Oh, that's sweet.
But I'm also teaching him how to do myofunctional therapy. So.
See, I mean, it can be done.
Yeah. Okay. So, if someone listening to this is like, "Hey, this sounds like something I need to pursue," let's provide them with an avenue to do that. Meaning, how can they get a hold of you or look for someone in their area?
Yeah, so I have a website they can go to. It's myWholeMouthHealth.com, and whole is WHOLE. It's not like there's a hole in something, so it's myWholeMouthHealth.com. And I'm willing to help do whatever. I have friends. We've now lived in 5 different states in the past 7 years, so I have friends all over who are always texting like, hey, I think we have this issue, like, where should we go? And so I'm willing to help people find someone that can help them if I can't. Because a lot of times it's multi different doctors and specialties approach. It's not like I am not your end all be all. Mm-hmm. And I found that in my journey, like I had to go to this person, then this person, then this person, and every time it's like a layer of healing happens, but there's so more. So if they reach out to me, I'm more than happy to help. So my website and the phone number is on, or the email and phone number on the website, but the email, if it's helpful to have that, is info@myWholeMouthHealth.com. So.
Yeah, that's amazing. And then what about, like, when I'm providing someone, well, I'll back up, on social media and even on this podcast, like, people love it when I will give them, something to try at home.
Yeah.
And so do you have something like that for us?
Yeah, so, I mean, there's lots of different exercises, but one of the things, especially if if they have a tongue tie that needs to be released, holding the tongue, so suctioning it, like almost like you're going to click, like, but instead of clicking fully down, just holding that tongue up and suctioning it, before you're able to get that frenectomy, usually a good doctor is going to make you be able to hold that for 2 minutes. One thing that's great about the exercise is it's kind of telling. That's kind of how I figured out, like, oh, my tongue, like I could touch the tip of my tongue up and all my muscles compensated to help me get there. but the back of my tongue literally could not go up. So if someone's unable to do it, that's kind of a good indicator of, now, I mean, it can take some practice, but like if you literally just can't, like that's a good sign of like, oh, I probably have some tongue issues. Or some people can do it, but like they will be in a world of pain in their jaw and in their face if they're trying to do it a lot, because all the muscles are compensating to help, which was another one of my issues. So
I and then that's an exercise, right? Like
so
suction hold.
It's like, I mean, it's called a lot of different things. Sometimes it's caves, it's lingual palatal suction, so just the tongue is suctioning into the roof of the mouth or the palate. And if you can, I guess I forgot to mention, you want the tongue inside your teeth. You don't want it like hanging out all over your teeth. It needs to be in the roof of your mouth and sitting up there. You want to start holding it like 10 seconds or so, and then if you can get to 2 minutes, that's excellent.
All right, there you go, listeners. 2 minutes. That's amazing. Lauren, thank you so much for being on the podcast. I know that this is incredibly valuable information, and especially for the moms out there, when your kiddo has something that, especially when you take them to your pediatrician and they just don't know how to help, and you're like, no, like my son or my daughter, there's something that we need to do to help this. This is incredible. Like, it's incredibly helpful for the moms and dads out there that are just wanting their kid to feel better.
Yes.
And I love that you take on the kiddos. Like, we want to prevent this from happening. Well, from getting to where it could be, like when you experienced it. Like, let's stop the daily migraine from popping up before it gets there. And that's incredibly valuable. So if you're listening to this and you've heard the other podcasts on myofunctional therapy, you've been hearing me talk about airway and breathing, I think it's time to reach out to Lauren and start working with her. Thanks again for being on the podcast.
Thank you so much.